This is catheter insertion. So the first thing I'm going to do is I'm going to confirm the order. So Dolly Parton has an order to insert an indwelling urinary catheter, and she's also allergic to latex. So that order is confirmed. So now I'm going to gather all my supplies. I have all my supplies right there. Now I'm going to introduce myself. Knock, knock. Hello, I'm Amanda. I'm going to be your nursing student for today. I'm going to perform my hand hygiene. Can you please tell me your name and your date of birth? Dolly Parton, 4/17/1985. Okay, are you allergic to anything like latex, adhesives, or betadine? Just latex? Okay. Well, everything we're using is going to be latex free, so that shouldn't be a problem. So your doctor has ordered a catheter to be inserted. We're inserting it to help relieve your bladder from that urinary retention and get that urine out. Does that sound okay? Okay. So now I'm going to do my integumentary assessment. So first I'm going to start off by asking her some questions. So when was the last time that you peed? 12 hours ago? Okay. Are you in pain right now? Yeah. How would you rate your pain? 7 out of 10? Okay. Where is that pain located? Just in your bladder? Okay. Can you tell me the quality or how your pain really feels? Like your bladder is about to burst? Okay. Well, I'm going to lightly palpate your abdomen to make sure that your bladder did not pop or anything. Okay. Palpate. Her bladder was very distended. How was your pain when I palpated? It got worse? How would you rate that? A 10 out of 10? Okay. So now I am going to look at her skin integrity. So I'm looking at her skin on her vagina. It's clean, dry, and intact. I don't see any signs of infection, such as like foul smelling odor, discharge, just foul smelling discharge, mucus, and redness and swelling. I also don't see any visible signs of trauma, such as deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. So now I'm going to help her into a position. Take off your gloves. That's okay if I just wash your vagina before I insert the catheter. Yeah, okay. Dirty linen, goes off, and sanitized. Okay, so this is a sterile procedure, so please remain still so that you won't get contaminated. My hand sanitizer. gloves are on. Once you get this situated. Okay, need to insert it. Okay, I do see a flash of urine, so I'm going to insert approximately 2 inches more. Okay. It's in. I'm going to take off my sterile gloves. So since this is a mannequin, there wasn't a huge flash of urine. But if it was a real person, you would see a flash of urine, and that would be an indication of continuing to advance the catheter. But since this is a mannequin and we have mannequin troubles, it won't have a sudden flash of urine. Okay. And the bladders in the mannequins 4 and 7 were not working. So, yeah. And this bladder would leak some. So, yeah. But if I did not see a flash of urine on a real patient, I will not inflate the balloon and continue on. So now I am going to secure it to their leg. I'm going to put this out of position that's lower than their bladder. Okay, now I'm going to dispose of everything. you like some Pericare? Yes, okay. Hand hygiene. Now, while I do Pericare, I'm going to look for visible signs of trauma like contusions and bleeding, and document that in my chart. I don't see any visible signs of trauma. No bleeding, no contusions. Okay, there's no swelling as well. Okay, take off my gloves. Before my hand hygiene, I would wash this and I'll put it inside the patient's bathroom. My hands are hygiene. And move you in a comfortable position. Would you like anything else? No? Okay. Here is your call light. It's within reach. I'll cover you up. Put the bed in the lowest position. If you need anything, let me know. And if that catheter is bothering you, and if it feels painful, please let me know. The bed lock is on. This lock is on. And I'm going to put the personal items